A very good morning, good afternoon, and good evening to all of you who have gathered here today from different parts of the world at the 3rd Annual Global Media Forum in lead up to World AMR Awareness Week, or WAAW as we call it, which is observed from November 18th to November 24th every year. This Global Media Forum, which is co-hosted by Global AMR Media Alliance or GAMA and CNS, is being organized to sustain awareness and support media understanding and communications on the key aspects of antimicrobial resistance, or AMR as we call it, and strategies in fighting AMR across human, animal, plant, and environmental health sectors. As we all know, AMR occurs when bacteria, viruses, fungi, and parasites change over time and no longer respond to medicines, making infections and illnesses harder to treat. AMR is impacting not only human health, but also affecting animal, plant, and environmental health. The multisectoral One Health approach, which recognizes the interconnections between people, animals, plants, and environment, is key to tackling AMR. Today we have with us very high-level distinguished speakers, including senior experts from the quadripartite organizations that have united to address the threats of AMR to global health security. These quadripartite organizations include the Food and Agriculture Organization of the UN, or FAO, the UN Environment Programme, or UNEP, the World Health Organization, WHO, and the World Organization for Animal Health, WOAH, WOAH. Today's program will have 3 sessions. In the first session, we will get an overview of the global perspectives of AMR and key quadripartite strategies. Session 2 will be a panel discussion with experts from the quadripartite agencies on the technical aspects of AMR. Session 3 will see the formal launch of the Global AMR Media Alliance, or GAMA as we call it. Each of the first 2 sessions will be followed by a question and answer session. Some quick housekeeping announcements before we begin. Simultaneous interpretation in French and Spanish languages is available for today's program. The original audio is in English, and you can press the interpretation icon, which you must be seeing on your screens, and choose your language. Participants can please type in their questions and comments in the Q&A box, even as the speakers present. You do not have to wait till the end of the session to do so. Please also mention the name of your media outlet. Only questions relevant to the topics under discussion today will be taken up. We will also be sharing with you in the chat box a media pack with links to important resources where you can find more information about AMR. Without any further ado, I invite Uganda's Minister of State for Environment, Honorable Madam Beatrice Atim Odwong Eniwar, to deliver her opening remarks. She is a member of the Global Leaders Group on AMR. This group of world leaders and experts from across sectors works to accelerate political action on AMR. Welcome, ma'am.
Thank you very much, Your Excellency, participants. Ladies and gentlemen, do you hear me?
Yes, we can hear you.
Am I heard? Thank you. I thank you very much for inviting me to speak to this very important event today. I'm Beatrice Atim Odwong Minister of State for Environment in Uganda. And I'm a member of the Global Leaders Group. We are on AMR. Hello? It should be noted that we are at a critical point in time to act against AMR, that is antimicrobial resistance. We are less than a year from the high-level meeting of AMR at the United Nations General Assembly, the WOAH 2024. However, the attention to AMR is growing, and it is rightly so. The WOAH high-level meeting on AMR in 2024 is a critical opportunity to further accelerate the response and the will require determination to achieve consensus across the sectors. Already, AMR is associated with nearly 5 million human deaths every year, overwhelmingly in the low and middle income countries like Uganda, where the burden of diseases is the greatest. The causes of AMR are complex and interrelated in human and animal health sectors. Overuse and misuse of antimicrobial are driving the development of resistance. Sanitation, hygiene, and the waste management across sectors are fueling its spread. The economic costs of AMR are enormous, and this needs actually to be quantified to enable equal measures and corresponding funding to be put in place. We have the tools to prevent and mitigate the AMR crisis. What we need is the political will and the resources to bring these responses to scale around the world. Chaired by Her Excellency Mia Mottley, Prime Minister of Barbados, the Global Leaders Group was formed in November 2020 to collaborate globally with governments and international agencies, civil society, and the private sector through the One Health approach to advise on the advocate of political action on AMR. Representation in the group crosses all One Health actors, that is human health, animal health, agro-food system, and the environment is being worked for. Uganda have spearheaded this and working together. The Global Leaders Group takes multisectoral One Health approach in all our work that aims to achieve optimum and sustainable health outcome for people, animals, and ecosystems, and recognizing that health of humans, domestic and wild animals, plants, and the wider environment, that is our ecosystem, are closely linked and interdependent. As one of our first tasks, the Global Leader Group defined 6 key priority areas for AMR advocacy in our action plan. Political action, transforming systems, improved surveillance and monitoring, increased mobilization of internal and external resources, increased effective and affordable innovations across sectors, and environmental dimension of AMR. I must emphasize the links between the global climate crisis and the AMR, because changes occurring in the natural environment due to climate crisis are impeding the spread of infectious diseases, including drug resistance in infections. There is a need for a greater focus on the environmental aspect of AMR in low and middle income countries, as mentioned earlier. AMR is in the unstudied and inadequately addressed. We need to unpack this and use simplified scientific language. The science and terms around AMR are too complex for the ordinary end users like farmers and non-scientists. We need to build capacity, regulation, and enforcement, and simplifying the science to make it palatable to the general public. And this is a critical demand. To raise awareness and increase our understanding about AMR, we need to go back to the basics of AMR. Not many people understand this all. The media has a critical role to play in providing accurate and relevant information that will urge the public to prevent AMR and prevent the misuse and overuse of antimicrobials. The media plays a large role in raising awareness of AMR at local, national, regional, and global levels. This is very relevant. Our communication tools have to remain accessible to everyone. I urge you all to build on the momentum in the global response to AMR and may indeed agency, vision, and the concrete commitments to address the AMR as envisaged by the leadership. I ask the media to act by increasing the visibility of AMR and to generate interest through educating the public on AMR and especially the use.
We cannot hear you, madam.
We lost the connection. The quality was very bad with Uganda. We are very sorry about that. Thank you.
Okay. I thank madam for such a lucid presentation and for finding time from a busy schedule to be with us here today. And we all understand, at least I also live in India, and we can understand how the internet goes on and off, and we have to live with these realities on the ground. So sorry for that, because we always keep our fingers crossed while we are on a webinar or any online session. I also request the participants to please use the Q&A box for asking questions only, and not for any other purpose. And when you are asking the question, you may please indicate the name of your media outlet. Thank you. I now welcome Vanessa Carter, an AMR patient survivor and One Health advocate. Vanessa is chair of the WHO Task Force of AMR Survivors. She is also the founder of the AMR Narrative and is a patient advisor to several organizations. Over to you, ma'am.
Thank you so much, Shobhan. Thank you for having me here today. I think the first thing that I'm going to do is I'm going to start giving you background on my story and how I survived AMR. So in 2004, I was 25 years old. I had a severe car accident in Johannesburg, and I ended up in Charlotte Maxeke, Johannesburg Academic Hospital with a lot of massive injuries. I had been resuscitated on the side of the road. I was put onto life support, and I had a lot of injuries. I had multiple fractures in my face. I had a broken jaw, broken nose, smashed right maxillary sinus, which is basically the area of the bone here. And I had also lost the right eye, and I had severe facial lacerations, a head injury, major abdominal injury. I had 2 laparotomies at the time, fractured pelvis, neck injury, and back injury. And although I had all these injuries, the most complicated for me, which would take me another 10 years following that to recover from, was to my face. And the reason for that was because I needed to have different types of super specialists, different types of doctors that specialize in different areas of medicine to reconstruct my face. And so over the years following the accident, I had 4 different prosthetics implanted. And in my 6th year and the 4th facial prosthetic, it was sort of a routine surgery, I thought, when I had it done. And when I was discharged from hospital, I went out shopping one day, and I came out and I got into my car and I felt moisture on my face. And I didn't quite know what this was. So I pulled down the rearview mirror in my car, and it was, seeping with moisture, all over the face. It was basically, pus coming out from this prosthetic that they had implanted. And so I was admitted into emergency surgery, where they did what they called a debridement, meaning that they cleaned the prosthetic and they did a little bit of reconstructive surgery to fix up the damaged tissue. And after that surgery, 2 weeks later, the infection came back again, but this time worse. And so we did the same thing. We did a debridement. We did a little bit more of a tissue reconstruction because now even more of the tissue was damaged. And after that surgery, I went back again because the infection came back, and again, it was looking worse. And so this kind of went on for 11 months. And during that time, I was under the care of my different specialists. So in other words, it was a maxillofacial surgeon, it was a plastic surgeon, it was an ENT surgeon, meaning an ear, nose, and throat surgeon. It was an ophthalmologist because of the complications that I had with the artificial eye and the ophthalmic part of it, until eventually the tissue was so badly eaten away that I'd almost lost huge portions of my face. So you can actually see there's a line on my face, where the actual damage was. And so I went into another surgery again, and this time I built up quite a good relationship with my plastic surgeon. And he said to me, Vanessa, when you go into theatre, I'm going to be in the theatre next door. It wasn't a plastic surgery operation, it was an ENT sinus drainage operation. And he said, if I see that infection is still on that prosthetic, I'm going to remove it. And so I kind of, didn't believe him because I thought I hadn't given him permission to do it. But when I woke up, the prosthetic had been removed, and, and I knew that it had been sent off for testing. So this kind of rang alarm bells because I thought, why is nobody talking to me about this? What is going on? Why is this? Does it sound like it's such a dangerous infection? Why did he take that risk on his shoulders? And so I phoned the pathology officers and I asked for a copy of the test. And what got emailed to me was a whole lot of R's and S's on a piece of paper with a whole lot of different names of antibiotics on the left-hand side. And so the first thing I did, obviously, was go on the internet and say, what is this? Because at the top of the test, it said MRSA. And so, I guess what I was typing in was how to understand a test result as a patient. And up came the term antibiotic resistance. MRSA was antibiotic resistance, and these different antibiotics that I was now either resistant to or susceptible to. So I went back to my plastic surgeon and I asked him, what's sort of going on? And he gave me sort of a very basic overview And yeah, then they couldn't do any surgeries over the next year. I had to wait for the tissue to settle. But I had to cover my face. I looked terrible. I couldn't go fetch my child from school because the kids would get scared, I couldn't wear an artificial eye. My face was very red and very full of fluid, and swollen during that whole year. And of course the year before where I was going for the surgeries as well. So, so during that year, I got on the internet again, looking for information about this. What sort of decisions should I be making as a patient to reduce my risks of infection, to avoid this antibiotic resistance again. And I eventually found a doctor in the USA, because the problem in South Africa was we had a shortage of certain doctors. And this doctor was a craniofacial surgeon. So he worked on both the soft tissue and the bone. So he gave me advice and he said, you need to find a doctor that can do a bone, work with the bone, don't put in, any foreign objects, which we did. I found a professor in Johannesburg that gave the exact same advice. And so we did the surgery, we cut the bone, we realigned it, and I did get an infection back again, this time in the bone and the skin. And, I always tell people if I had had 10 more surgeries after that, making bad decisions as a patient, it would have been a lot worse. Yeah, so I basically had to deal with that for another year. And what he did was he rotated antibiotics until finally we could do a small plastic touch-up surgery, and I could uncover my face. In fact, for the majority of that 10 years, I used to go and buy myself, sunglasses, or, again, I became, one of my plastic surgeons said, we're going to actually get you into theatre because you're probably one of the best people we know that knows how to apply an iPad because you've worn so many of them. So, after going through this experience, which, as you can imagine, 10 years of your life is a very long time, I lost most of my life between 25 and 35 years old, dealing with in and out of hospital, and not being able to look in the mirror without seeing a changing face. I was working in communication at the time. I was working in marketing. And I think that the one thing that really struck me was that the doctors weren't talking to me about this. The pharmacist wasn't talking to me about this. When I learned about antibiotic resistance, it came as a surprise. Why wasn't it common knowledge? Because it's such a widespread global threat. Whether you go for surgery, whether you, you cut your finger and you get an infection, that could become resistant if it's not, treated properly, or if you pick up a resistant type of bacteria, in that open wound. So I think that's a massive call for the media. How can you, make sure that this kind of message reaches patients like me in a situation where our lives depend on it? In my case, it was, yes, I nearly got a bloodstream infection and sepsis and nearly died. But I'm also living with a severe disability at the moment. I'm living with a facial disfigurement, which was partially caused by the accident, but exacerbated by the actual fact that we couldn't treat this infection, and also that I couldn't take a more active role earlier on. And so as an advocate, I've since worked in different areas. I've worked in medical education, so I've actually gone back to the Johannesburg Hospital. I've worked with the antibiotic stewardship teams to share my story, so their nurses and their doctors working in the stewardship teams understand exactly what the impact is on the patient themselves. I've worked in medical research on numerous projects, including co-authoring research. I've shared my story quite extensively with the media because, of course, storytelling, and I would, say, I encourage you as a media to go out and find stories, because when we do that, we make this very scientific topic much more relatable, especially for policymakers and especially for patients themselves. Because when I was on the internet looking for information, I was coming across lots of studies, lots of scientific words, and even to this day, after being an advocate now for 10 years, it still sometimes goes over my head. So that would be amazing, if the media could really focus on that to build common knowledge among the public. I've also worked with policymakers, so I'm part of the APRIA group in the UK. That is the Ministerial Advisory Committee for Antibiotic Prescribing and Healthcare Associated Infections. I'm also a patient advisor to the WHO Strategic Technical Advisory Group, and that's been quite an amazing opportunity to be able to share my voice as a patient in terms of the Global Action Plan and many other opportunities that have been presented by that. I've also worked with the Africa CDC quite extensively, where they did the policy, the strategic framework for AMR in Africa. And more recently, through all of this, one of the things I realized was that advocacy is not an easy thing to do. So I started a charity called the AMR Narrative last year, and it's been registered in about August this year. And what our focus really is on is advocacy development, because from personal experience, when somebody said to me, join a policy group and this is how you do it, that was missing. Tell your story and this is how you do it. That was missing for me. So I was very lucky. I did have opportunities where I could apply for scholarships to learn how to tell my story, but not everybody has the same opportunity. So I think as a media, it's also important when you approach patients to ask them, when they tell their story, which way they would be most comfortable, because whether that's a blog, not everybody's comfortable with writing, or whether that's a video or some other means, I'd really try and get the story out as meaningfully as possible to that person. The other thing that we do is community development. And as Shoba said, I'm now the chair of the WHO Task Force of AMR Survivors. And within that alone, there are 12 other patient members and patient survivors that you as the media could really leverage, to show that AMR is not just about MRSA, which is what I had, but it is multifaceted. We've got members that have got, have had implications due to HIV/AIDS, members that have had implications due to TB, so extremely or extensively drug-resistant TB. We've got sepsis survivors. We've got healthcare professionals that have worked with patients that they've lost. So we've actually got a webinar on the 21st of November at 4 p.m. Geneva time that I would encourage all of you to attend as well. And thank you. I think that would be the end of my presentation.
Thank you very much, Vanessa, and hats off to you for your never say die attitude and for overcoming so many seemingly unsurmountable health problems and becoming an icon for all of us. Your grit and determination makes you the most beautiful person I have ever met, Vanessa. You're a living example of how AMR can impact the life of any one of us. It is indeed, as you said, a multifaceted global threat. All force to you for your advocacy work. We are there with you, and we will join hands with you to spread this far and wide. Thank you very much. Our next speaker was supposed to be Dr. Helices Getahun, who holds two important positions. He is the Director, Global Coordination and Partnership on AMR, and also the Director of the Quadripartite Joint Secretariat on AMR at WHO headquarters. Unfortunately, at the very last moment, he has had to go on an urgent travel, so he is not with us right now, and we will try to share his statement later with the participants. So there are certain things which are just unavoidable in life, and this happens to one of those moments. So we now move on to our next session, which is a panel discussion with technical experts from the quadripartite. We have with us today Emmanuel Kabali from the Food and Agriculture Organization of the UN, then Wondbozen Asnaki Kibre from the UN Environment Program or UNEP, Philip Matthew from the World Health Organization, and Javier Yugueros Marcos from the World Organization for Animal Health. And please pardon me and forgive me if I have wrongly pronounced any of these names. There will be 2 rounds of questions, and panelists are requested to take not more than 4 minutes perhaps to answer one question in the interest of time. My first question is to Emmanuel from FAO. Emmanuel, every year the quadripartite agencies, that is the FAO, UNEP, WHO, and WOAH, and other stakeholders around the world celebrate the World AMR Awareness Week, which we know is from 18 November to 24. How does having a week dedicated solely to raising awareness on AMR help reach global audiences and encourage collaboration across sectors?
Thank you very much, and good afternoon, good morning, good evening, attendees. Indeed, AMR is very complex, and listening to Vanessa, I think I've heard her story, maybe this is the 5th or 6th time. You see how complicated the situation is when you talk about AMR. And now being a cross-cutting issue, AMR means something different in human health compared to animal health or plant health or the environment. So having a dedicated week globally to actually reflect and focus on this existential threat is very important. It's an indication of global commitment to the cause. And of course, as the quadripartite, we, over the years, I think over almost the last 10 years, we have made efforts to try and put together and demonstrate how from a One Health approach, we could handle this existential threat. Specific targets that we have actually managed initially was raising awareness about AMR, and now better than 6-7 years ago when we started, AMR is better known in the world. But knowing is not enough. So we also use this week to set high-level agenda on AMR. We gather leadership, global leadership, regional leadership, and national leadership across the continent from human health, animal health, environment, to discuss and share wins and challenges, new information coming up to define better the high-level agenda on AMR. We also highlight the collaborations and the successes we are making, because AMR is a very difficult issue to deal with and address. And we are so under-resourced in terms of human resource, financial resource, and other capacities. But when we share wins every year during this week, we encourage and help and support one another to move forward. And in addition, we also motivate for more impactful action. There are several examples that we can raise about how this week has been effective in Africa, for instance. With FAO taking leadership initially, we built a regional communication strategy, a regional One Health AMR communication strategy that has helped harmonize the communication of AMR across the various sectors in Africa. Globally as well, we have, for the past 5 years, worked together with a common theme and a common communication approach to antimicrobial resistance. We have actually even moved and evolved the name of WAAW from World Antibiotic Awareness to World Antimicrobial Awareness, and now to World AMR Awareness Week. So that building of consensus and strengthening one another and strengthening the agenda has really been very useful for this week. But awareness is not enough, and I would like to underscore that. We need to now strengthen ourselves and move forward to more impactful action across the sectors using the One Health approach. I think it's 4 minutes, and I'll stop there and give back the floor to you, moderator. Thank you.
Thank you. My next question is to Vonhosen Asanike Kebre. Am I pronouncing your name correctly, Vonhosen?
Yeah, absolutely. That's
okay, thank
correct.
you. And then I'll call you Vodi, I think, as you are.
Wandi would do. That
Wandi
was the problem. Yes.
Yes, Wandi would be best. So Wandi is from UNEP. One day, the theme of World AMR Awareness Week this year is preventing antimicrobial resistance together. What does that mean? And how can the public contribute to preventing and mitigating the spread of AMR?
Thank you very much. Thank you for inviting UNEP to this session. Let me thank Vanessa for telling that story, because what we are missing is exactly showcasing these practical examples. Information is not enough. Information has to be translated into knowledge, and we need to bridge that gap. The knowledge action gap is about creating value. How do you create value? Tell the stories. The stories like Vanessa, also Madam Minister from Uganda, when she talked about, we're losing 5 million people a year from AMR. I mean, these are shocking stories, but then how do we, from information to action, how do we translate that? So I refer to one of our old phrase that in sustainability that says, think global, act local, meaning what you do at the local level, what you do in your house, in your community, in your schools, in your organization, makes a huge difference. And then key message being appropriate use, not misappropriate use of antimicrobials. And for that, of course, the One Health approach, where we have the quadripartite alliance between the 4 organizations. How do we make sure that in sending this acting together, but also to ensure that we prevent and mitigate the spread of AMR is actually working together, bringing together different sectors, that working as one. And I think that is the key in terms of addressing what Madam Minister said. We shouldn't be having 5 million deaths every year, but also we will not have people like Vanessa, who just said she lost 10 years of her life, which is very sad, but her story can actually save as many people as possible in the future. So these are just a few things I wanted to reflect on. Over to you. You're muted now.
Sorry for that. Yes. Next question is for Philip Matthew from WHO. Philip, AMR is a technical and medical term and is not widely understood by the public. How can we communicate AMR better in a less medicalized way so that it is more understandable to the general public?
Thank you, Shobha, and good morning, good afternoon to everyone. I think it's a very, very important question, and we are also grappling with the same challenge. It's a very medicalized, almost bordering jargon, and how do we unpack it? How do we break it down and communicate it effectively to people around us? So there are several challenges that we are facing. One is the lack of a uniform language. Some people refer to it as antimicrobial resistance. Some publications, antibiotic resistance, drug-resistant infections. Some people refer to it as AMR, ABR, AR, bacterial AMR. So the lack of a uniform, universally agreed language is a major challenge. The second part of the challenge is there is no appropriate terminology or phrase in many languages. So the translations become very, very complex and challenging. The third is the complexity of the issue itself. If you look at it, the drivers of AMR are in several sectors, and the impact is also multisectoral. Misuse of antibiotics happen in human health, in animal health, in agriculture, and several other sectors. And again, lastly, the use of phrases like silent pandemic, it generally conveys a wrong message sometimes, that it's a very distant issue which may affect us sometime in the future. So people lose that urgency. So these are all the challenges in communicating about AMR, and we have a set of solutions in mind also. One is when communicating with general public, we should definitely frame it as an issue in which medicines have stopped working for infections that they are meant to treat. So people are dying of infections. Even simple infections are becoming very difficult to treat. So that is the core of the communication, or that's the core of the message. Then the second part is it's not a distant issue. It is killing people in millions right now. And it is wreaking havoc in medical systems, in healthcare systems. The third aspect of the communicating about antimicrobial resistance is the cost. It is already costing us billions of dollars. We have good projections available to say that, it is going to be a huge burden on the people, on the society, on the countries, on the international, efforts to strengthen healthcare systems. And one very important part that we stress all the time is AMR can happen to anybody at any given point of time. It can happen to anyone at any time. Vanessa's example is a very good one. We have the WHO task force of AMR survivors, in which there are 12 members, each of them with very powerful, compelling examples. And the urgency part of it, we cannot wait. It's not a distant issue. It is killing people. We cannot wait 2 years or 10 years or 15 years to act. The action has to happen now. And lastly, everybody can contribute, be it awareness raising, be it policy change, be it some specific interventions to improve use of antibiotics or preventing infections. Every single person can contribute. So these are the 5 or 6 different frames for constructing messages around antimicrobial resistance. And lastly, the importance of stories. I think Vanessa highlighted the importance of stories. These stories are more powerful. These are more relatable than actually numbers and statistics and figures. So we should make an effort to actually identify people with such compelling, powerful stories and narratives, and we should communicate through them. That is the best way to actually reach out to a wider population and make it more relatable and simple for people to understand. Over. Thank you.
Thank you, Philip. And very right. It is stories, it is our own lived experiences which should show the light to others. Vanessa's is one such example, and there are others as well. We have to bring them to the fore, I think. Next question is for Javier from World Organization for Animal Health. Javier, tackling AMR poses complex challenges as it affects not only human health, but also animal, plant, and environmental health. And somehow all these appear to be linked together. Now, because of this, the Global Action Plan on AMR advocates a One Health approach. Can you please explain what this One Health approach is and why is it essential to tackle AMR?
Thank you very much for the question, and thank you everyone attending this important webinar. Before getting into the approach, let me start with the concept, because it's a very old one. It was defined already 200 years ago, and it seems that we have not yet completely understood the concept. So 200 years ago, the scientists explained it in a very simple manner. Disease processes are very similar between animals and humans. A lot of things and a lot of discoveries have happened since then, and they have helped us to understand that the health of humans, animals, both domestic and wild animals, plants, and the wider environment are interlinked and interdependent. And this is the last part of the sentence, the one I would like to stop for a moment, and the one that I would like to emphasize is that we are all connected and interdependent. That means that whatever it happens to one of us, whatever action is taken in one of the 4 sectors that we have defined, the others will inevitably be affected and impacted, for better or for worse, whether we like it or not. So once we have understood this, the approach of the One Health is quite simple and straightforward. The 4 sectors need to be connected and act in a coordinated manner as they are interdependent. That's the key word I would like everyone to retain here, that all of us are interdependent. Look at the recent examples in diseases like Ebola, flu, or COVID-19. They all have an animal-human component. And if we even go a little further, we have an environmental component on all those because of the displacements and the closeness of humans and animal populations. When talking about AMR, we used to say that it's a complex matter. And it's true, it's complex, it's cross-cutting. But we can make it very simple to understand, and this is what I would like to try to do using 3 different examples, because the interdependency component of AMR is right in front of us and we cannot see it. Let me give you 3 examples. The first one is the use of fluoroquinolones. I'm becoming a little technical, but fluoroquinolones, or levaquin, like many people most know them, are important antibiotics to fight infections in both human and animals. Some of these infections are caused by common organisms like Salmonella. Salmonella, it's a name, even if it's a technical one, that speaks to everyone. Every time that fluoroquinolones are used, the microorganisms, these bacteria, are going to adapt, are going to try to evolve and defend themselves, and that can lead to resistance. If this happens, and I'm not saying this can be a possibility because it's a reality, it really happens, the development of resistance, then the fluoroquinolones would be completely useless and we would be losing their efficiency. The One Health approach comes here. If every sector tries to solve the problem on their own, without communication, without dialogue, then we will be completely losing the efficiency. However, if we do coordinated actions like the one that WHO is exerting, for example, they are saying that these antimicrobials, these antibiotics are critical, high priority and critically important for humans. And then on our end, on the WOAH side, for animal health, we are restricting the use of these antimicrobials as a second line therapy, second line option, and we are banning, we are telling every country to phase out the use of these antimicrobials as growth promoters. This is one example of coordinated actions that if they are not taken into consideration, we would be completely losing time. Let me highlight two other examples because we used to talk a lot about antibiotics, and those are the ones where we have to put our priority actions. But we have not to forget that we have two other important antimicrobials in the picture. One is fungi. Fungi are very commonly a source of infection in immunocompromised patients for less technical reasons, let's say leukemia, transplantation, patients under chemotherapy. Fungi can cause infections in those patients. Fungi can also cause infections in plants, for example, in tulips. And there are several studies showing the association between the use of antifungals in plants and the development of resistance in these fungi that can cause infections in immunocompromised patients. The literature is plenty of these examples, and we must not forget that antifungals are also important medicines. And the last one I would like to mention without going into parasites is viruses, because viruses, we used to think that they cannot be treated, but antivirals are very useful medicines against viruses. And we have a lot of reports from the 2000s where we were seeing that the misuse of some antivirals were provoking the development of resistant strains of influenza viruses, both in animals as well as in humans. The misuse of these antivirals is essential in preserving their efficacy for generations to come. As I said, the approach is quite simple. It's just communication, dialogue, and coordinated actions. Here you have 4 organizations. We talk to each other at least every 2 weeks. We share concerns, we share limitations, we share the problems, and we always try to find ways forward. We all have our cell phone numbers in our list of contacts. I would like to call you and to invite all of you to have the 4 counterpart contacts in your mobile phone if you claim to be working under the One Health approach. That's the most simple, that's the simplest way of using and implementing this approach. Thank you very much, and over to you.
Thank you very much, Javier. Now we move on to the second round of this discussion. And in this, I will be asking sector-specific questions. So Emmanuel from FAO, can you please share an example of how FAO supports countries in preventing and responding to AMR?
Thank you very much, Sharon. A difficult question to ask because we do quite a lot, but I'll anchor my response on what my colleagues have said. And I think Wanda said something critical about the think global and act local. And FAO is present in 130 countries. So when the issue of AMR began 9 years ago, one of the challenges we had was how to support countries in developing a national action plan that is inclusive, that is not just anchored on human health and public health, because the animal health and food and agriculture are critical in this matter. Antimicrobials are used extensively in both human and in animal and plant production. So one of the key areas we support our countries is through our projects, and in many countries. I think we've reached over 70 countries now through project activity. And first is to move from national action planning to actual action. And I think Wande also talked about the knowledge action gap. So we try to reach the countries within their diversity to domesticate the issue of AMR in the National Action Plan, to include food and agriculture, to include animal health, and also to include practical actions that will reach, that will have impact at the farm level, at the grassroots level. And what I think we found very advantageous in this case is when we use communication experts and social scientists to actually raise awareness on what AMR actually means to a farmer. Because when we talk science, even when we talk salmonella and certain medicines, farmers don't really care. They don't care what penicillin is. They don't care what a fluoroquinolone is. All they care about is the health of their animal, the productivity of their crop. And so we try to support in each local setting. And when I say local setting, to just make you understand, Indonesia and Mongolia, Peru, Colombia, and Kyrgyzstan, or Nigeria, Ghana, Zambia, Uganda. Those are all diverse places when you look at animal production. I think Javier really is the closest to understand what I'm talking about, because the challenge is real. AMR is not a very big issue to a farmer when their animals are sick and their productivity is at risk and their livelihoods are at risk. And our aim has really been to support from a local perspective, action, real action on the ground that acts towards controlling AMR sometimes without even mentioning AMR itself. Sometimes we talk about good practices on production, biosecurity, and issues like that, self-awareness, protecting your family and protecting your income as ways to actually motivate action on AMR. And it's very important when we use other technical experts besides us biologists, communication experts and social scientists, behavior scientists, because they may actually have a better way of communicating this issue that is scientific to the local and ordinary people. And so that for us has really been useful at FAO, is strengthening these other areas to galvanize action around this very important and very complex issue. Thank you very much.
Thank you. Wande, can you please explain the key roles that environment plays in the development and spread of AMR, and what actions can be taken to mitigate them?
I just, for those who are interested absolutely in this topic, I actually posted a recent publication we put out, more specifically, bracing for strengthening the environmental dimension of antimicrobial resistance. And this is really linked to what we call the triple planetary crisis, impact of AMR, the link between AMR and climate change. As you well know, the changing weather patterns can be associated to a spread of emerging or emerging diseases. A loss of biodiversity can have an impact, or AMR has an impact on that. But also the bigger picture on pollution, the whole aspect of chemicals and waste. A good example, that if I zoom into one of the Sustainable Development Goals in terms of SDG 6 on water quality, and I think that the AMR can actually significantly impact on water quality. That means people will be infected by poor quality of water. But one area particularly where we are investing is in terms of the implementation of the link to the Sustainable Development Goals. As you well know, this is one of the most important development agendas probably since 2012 in the context of prosperity for all. A more sustainable planet for all, and partnership and peace, building blocks in terms of a bigger sustainable development agenda that include addressing the triple planetary crisis. when you look at this agenda, we have 17 goals, but just like my friend from WOAH said, interconnected, the term you used, these are also very interconnected goals. If you start with the poverty part of that, if there's a drug resistance infection, guess what? Who is the most affected by? The poorest in developing, or least developed world, where the minister from Uganda talked about 5 million deaths. Most likely these are the people who are the poorest of all. What else does that mean in terms of goal number 2 on our own food systems, our ability to feed the world? It would be affected by that. In terms of the gender gap, AMR particularly also affects what we are seeing. Vulnerable people are more, they've become drug resistant. That is women, children, that is what we're talking about. Look into jobs. AMR means you are actually affecting the workforce of the future, the economic growth of your own country. The cities we live in, are they more sustainable? When I talked about SDG 6 in the context of water, it is also look into crowded cities. What does that mean in terms of the implication on water quality, the water discharge that we have? It has a significant impact in the cities that we live in. In the context of one of the major problems in terms of the triple planetary crisis is actually look into what are the root causes. It is unsustainable patterns of consumption, unsustainable patterns of production, of course, our own unsustainable lifestyle. And this has a significant impact in terms of human life. I could go on and on, like its impact on climate change. The drugs and the vaccines that we have today, will they be effective in the future as we see a changing climate? The same, our impact on our seas and our oceans. So all this, they're interconnected issues, and that's why what I just put in the publication I put in, it's really looking at, okay, how do we actually manage some of the sectors and the value chain that potentially the drivers of AMR. Look at the pharmaceutical, other chemical manufacturing. It's a huge impact as one of the things we are trying to address. Of course, agriculture and food production, that is an area that also we need to look at it very carefully, and including the healthcare system. So these are interconnected, multifaceted issues, but at the same time, in terms of addressing it, what we call through the triple planetary crisis lenses, look into these areas in terms of addressing the AMR crisis that we have. It's no longer silence. It's not silent anymore. If it is killing close to 5 million a year, I don't know how that can be silent. It's a devastating state of affair, and we need really to look into. In the beginning, as I said, this is not about information. We have more than enough information. How do we turn that information into a knowledge that we can actually act on? Over to you.
Thank you, Wondi. Very well said. Yes, we know that, but we have to spread the message, and we have to realize, each and every one of us, what role we can play. Philip from WHO. Philip, are you involved in any upcoming global initiative or event related to AMR? And if yes, could you highlight why is it important, and how can the media get involved?
There is a lot of very interesting events happening during WAAW. I'll just focus on World AMR Awareness Week, because this is a kind of a curtain raiser for this year's WAAW. So one very interesting event which is happening on the 21st of November is the Global Youth Dialogue on Antimicrobial Resistance, in which the Honorable Prime Minister of Barbados, Mia Motley, has agreed to participate. It's basically 2 youth advocates who are members of the quadripartite working group on youth engagement, discussing AMR solutions with the Prime Minister, and also discussing strategies to involve more youth-led and youth-serving organizations. What is the role of the youth in all of this, and how do we actually bring in more youth-facing organizations into this? And we know the power of youth. The global climate action has shown us how young people can actually move the global agenda and pressure political leaders into some kind of an action. So whether we can replicate those things in the AMR landscape, that is what we are trying to do, and that is on the 21st of November. Then again, Vanessa mentioned about the webinar being organized by the Task Force of AMR Survivors. For clarity's sake, I'll mention it again. The webinar is titled as The Voice of AMR Survivors in Awareness and Advocacy. Again, some of the survivors will present their powerful stories and their journey to become very active patient advocates. This is also on the 21st. It's right after the Global Youth Dialogue. One very interesting event on the 24th of this month is actually a closed-door session by UNITE, which is actually a network of parliamentarians. They are organizing a session for MPs from different countries to come together. UNITE is actually a network of parliamentarians, so they have a large network of MPs. So they are bringing them together to sensitize them about antimicrobial resistance and the possible legislative interventions which are possible, at the national level. So these are three very interesting events happening during WAAW. But all of this is actually leading to the high-level UNGA high-level meeting in 2024. Again, what we need right now from the high-level meeting is very bold and specific commitments on the table, and also some kind of a global financing mechanism to actually move all these interventions. We have been speaking about the importance of addressing AMR, the national action plans, the global action plan, but then still we don't have serious funding on the table. So whether we can push that agenda forward, and also specific commitments from different countries. There was a meeting last year and in Oman, which came out with something called a Muscat Manifesto, which outlined very specific three commitments, which was endorsed by 46 different countries. How do we take it forward and kind of work towards more such specific commitments from the countries at the highest political forum possible, which is the UN General Assembly? So that is the aim that all of us are working towards. Over. Thank you, Shobha.
Thank you. Thank you, Philip. And Javier, how can the media get involved in AMR communications and help raise awareness on this global health crisis? Media can do a lot, yes, but we need guidance at times also.
Yes, thank you. I would say from our perspective, what we would like to ask the media to help us with is in educating people and mobilizing people. And let me expand a little bit more on what is behind these two words. We believe that people will be mobilized if they understand what antibiotics, what antimicrobials are used for, why it is important to use them responsibly, and that they are essential medicines that we need to preserve for generations to come. So education is an important part. How do we do it? I'm not the expert in media. I'm a technical person. So I'm not going to give you any kind of advice on how to educate and mobilize. You have this expertise and you know how to do it. The only humble suggestion that we would like to convey to you is to do it without generating panic. Generation of panic can lead to people's mobilization, but as I said before, as we said before, it has to be in a coordinated manner. I think we all believe that there is a sense of urgency to act, but we are at the right time to act and constructively act upon. We do not need to generate panic. And the second suggestion that I would like to make to the media is to provide ways forward. It's very important to state the problem, to state the facts and why we have achieved or why we have arrived to this situation. But it's important to give to the people, whether we are professionals in the field or, as I can say very humbly, concerned or normal citizens, we all have our role to play in this adventure. We all, whether we are a father or a pet owner or a modest or a big agriculture, We all know and we are all facing diseases, and we are all tempted and knowing that antimicrobials are there to be used. Educating people on how to use them responsibly, that they are maybe not the first thing to do, that prevention, biosecurity, infection prevention and control, washing their hands, washing your hands is something very simple and that we should be doing all the time, are also measures that will help us to preserve these antimicrobials, as I said, for generations to come. So as I said, education and mobilization of people without panic generation, and showing ways to go, the alternatives, the solutions, how to use them, those responsibly. Storytelling is something that has been mentioned several times during this webinar, and the story of Vanessa is just overwhelming and very important to highlight the importance of the problem. There are much more and many out there, and in every sector. Stories of farmers losing their production, stories of pet owners losing their pets because of drug resistance organisms are out there and are powerful tools to convey the message, to educate people and to mobilize the people, as I said, without generating panic and showing the ways, showing ways forward. My last comment on this is educating the youth, mobilizing the youth. And I would even go a little farther, or in this case, a little earlier, which is educating the children. As soon as they understand that washing their hands is important, we can start educating them that these medicines are here for us to be useful, but we have to handle with care. We have to use them responsibly. So in one sentence, I would say educate, mobilize, no panic generation, way forward, storytelling, youth and kids. That would be my bottom line. Thank you very much.
Thank you, Javier. Thank you. Very well said. And I thank all the panelists for this really very informative and lively discussion, and for your pertinent suggestions around how media can do its two bits to help tackle AMR. We now open for questions and comments from the participants. We already have many questions in the Q&A box. And we are also sharing with you in the chat box a media pack with links to important resources where you can find more information about AMR and get involved in WAAW 2023. Also, UNEP has shared a link, so please be just keep your eyes on the chat box and get those links. So we begin with the Q&A question session. Vanessa, we have a few questions for you. One question is that you mentioned a webinar which is taking place on 25th. So there are some journalists who want to have the link of that webinar, and if they can join it. So they are interested in that. If you could post it in the chat box, please. Then there is a question for you, Vanessa, from Thailand. Jitima Tanakamalaka says, Vanessa, on spot presentation, is AMR response very medical? Should we think of people-centered response so that real reasons why medicines get misused or overused gets addressed?
Yeah, I think that, when we talk about AMR, it is a people-centered issue, at the end of the day, because, whether we go from animal health, environmental health, food safety, human health, it impacts people. It impacts every single one of us. As I said, I had a car accident and that resulted in AMR. But that was because of surgical interventions, and we all go for surgeries. So we all, like I said in my presentation, you might get a cut on your finger, and that might have come into contact with a resistant bacteria. And when it enters your bloodstream, that's what happens. You end up getting sepsis, with a resistant bacteria and so on. So, yeah, I think that, we need to be providing more emphasis on the fact that this is not something that just impacts somebody else. When I got AMR, when I got MRSA, and I didn't understand what it was, besides the fact that I didn't understand it, I also didn't think it could ever happen to me. So, but again, it could happen to anybody. The actual webinar that I mentioned as well is, as I said, the WHO Task Force of AMR Survivors. I try to share it in the chat. I'm wondering if you could see it. And I'm wondering if the WHO team could just share it again. Thank you. Yeah. You know, so this is really important, I think, for the media, if they want to be able to connect with other patients that are part of our task force to get dynamic stories. Because, you know, what's come up a couple of times, and, you know, as I said as well, AMR is not just about a hospital-associated infection. It's about different types of infections, you know, very common as well as urinary tract infections, you know, where you pick up a resistant, you know, bacteria or infection. And, you know, we don't have these conversations with our doctors, you know, in terms of why is this infection not going away? Are these antibiotics working, and so on. So, so yes, it is a people-centered approach. You know, we can't look at AMR as though it's like, you know, it only happens to you when you're a patient. There are certain prevention measures that you can do as a person before you enter the health system, and that would include infection prevention control, you know, and making sure that you aren't the center of, you know, the spread in the first place. Or eating food, you know, eating food that's, you know, or advocating for food that is using more of a responsible approach to antibiotic use in the first place. You know, so yeah.
Thank you. Another question for you, Vanessa, from Rita Dana. She's a very senior journalist from Indonesia and former editor of Jakarta Post.
Sure.
She wants to know, what is the more challenging for you as an AMR advocate? Working with doctors, policymakers, or the community? The majority of general public are not aware of the threats of AMR, while at the same time, doctors are also providing confusing information for patients as well as the media.
Yeah, that is such an important question. You know, and I would say that I wouldn't say that they're on an equal level. I would say that I have different experiences with each of them. Because I think that policymakers are still trying to learn what AMR is, as well as the general public. You know, they're coming from sort of the same place sometimes, and I think their focus is very much on the economic impact. You know, whereas, you know, we as patients, we focus on, for example, our mental, physical, you know, death to the family. I mean, you know, our personal experiences, and then also our financial experiences. You know, what did it cost me for 10 years to not be able to work? You know, what impact did that have on my family? And I think in turn, what impact did that have on the economy as a whole? Especially when you look at the numbers, you know, when you look at the statistics of, you know, what is this actually doing to the economy? So yeah, so that's kind of the policy making side. I think in terms of patients, it's not easy for them to tell their stories when the type of information they have and the understanding that they have of AMR is very, sometimes, not always, but sometimes very minimal. You know, and also, you know, AMR, I hear this very often, we battle to find AMR, you know, patient advocates because the survival rate is so low. You know, so when we do find patient survivors that can talk about these things, they rely very heavily on, you know, and this is one of the reasons why we started the charity. They rely very heavily on, you know, how do we do this? How do we approach policymakers? You know, a simple thing like, how do we use social media? How do we, you know, engage with them? Because there's so many divides between each of these fields, aren't there? And I think in terms of healthcare professionals, I've probably found that I've had the most interest from healthcare professionals. But I think what sometimes, you know, really kind of impacts me is that these conversations are still not happening. You know, not to say that if I shared my story, I mean, I have heard from people before where I've shared my story at a massive conference, for example, like the ECPIC conference last year, or 2 years ago, sorry, in Geneva. So that's the Infection Prevention Control International Conference. And I had a lot of people that said that they now talk to patients about what AMR is, but how do those conversations happen? So, I can't answer those questions, from my perspective. I can only tell you how my doctors, spoke to me, and what changed my circumstances. But yeah, I think, they're all, as I say, they're all very different. When working with patients, one of the biggest things I've found is to try and guide them. So, for example, if you've got a cancer patient that is advocating about cancer, they might not see the importance, the relevance of advocating about their type of resistant infection that they had. And so, it's that capacity development that's been really important to try and help them identify how they can be part of the community. And again, with TB, I've had patients that are amazing advocates in, their stories with extensively drug-resistant TB, but they don't quite know the avenues that they have to take and how they could become more involved in the AMR community. So, they focus very much on just the TB community. So, so I think that, again, this is where the media comes in, because if we start talking about these different disease topics and we start talking about the relevance of AMR and how it impacts them, we could make quite a huge difference.
Thank you.
Sure.
Philip, there is a question for you from Kalpana Acharya, who is editor of Health TV Online from Nepal. Kalpana wants to know, what about the over-the-counter sale of antibiotics and availability without the doctor's prescription? How can we counter that?
Well, I think this is a very, very relevant question. That is one of the main drivers of antimicrobial resistance in some of the countries, especially when the regulatory structures are not, doesn't have the capacity to deal with or oversee all the movement of antibiotics in the pharmaceutical value chain. So, and this has been acknowledged. Even the Global Action Plan mentions it. The Interagency Coordination Group on Antimicrobial Resistance in its report mentioned this. Even the latest people-centered framework or people-centered approach published by WHO mentions this as a target. So what I'm trying to say is has been acknowledged as a problem in all the global policy documents, but still a very reasonable challenge solution is not on the table. The primary reason for that is the complexity, I would say, because the value chain is so fragmented. It is controlled by several different players in the country level, and there are probably perverse incentives available for different parts of the pharmaceutical value chain to kind of increase the sales. There is incentive for increasing the sales at different points of the value chain. So that is a challenge that we are dealing with. What are we doing about it? So that is a very important part of this whole part of my answer. Is the quadripartite came together, or rather organized the first global joint summit of human and veterinary medicines regulatory authorities in May 2023. So again, the challenge is in country level, sometimes the regulatory structures are different for human medicines and for veterinary medicines, and sometimes they're not talking to each other as often as we want. So we try to bring them together on a global platform in May, and then the primary theme of that summit was actually phasing out over-the-counter sales of antibiotics. And subsequently, different parts of WHO has picked up the thread, and the AMR division organized a global consultation early this month on 1st and 2nd of November, again to kind of find out the feasibility of WHO-led global campaign to phase out AMR, or rather over-the-counter use of antibiotics, and also the contours of a campaign. Who should be the target audience, or who are the stakeholders who need to be involved, and what are the things that we should aim as low-hanging fruits or easy targets. So a lot of things are happening. Hopefully, in the next couple of years, we will be able to come out with more guidance documents. We should be able to come out with specific campaign instruments, specifically looking at phasing out over-the-counter sales of antibiotics. Over to you, Shobha.
Thank you. There is a question from Lahiru Sandaruban. I am a poultry veterinarian who promotes antibiotic-free chicken, but it is very hard to make people aware about AMR with their poor knowledge. What can I do? Would Javier like to answer, or any of the panelists? Yes.
Well, I can take that one. In fact, first of all, congratulations for raising animals antibiotic-free and having such conditions that antimicrobials are not needed for treatment or control of diseases. Then your question is how to make people understand that this is a good thing. And it relates to what I was saying before, which is the role of media. It's educating people about the fact that there is a problem. Many people do not even understand, do not even know that there is a problem, that antibiotics or antimicrobials are just things that we have in our medicine box and that we can take them whenever we want. So it's not your only responsibility to do that, it's everyone's responsibility, and this is why we are here, and media can play an important role in educating people about the problem. And as I said before, about the ways forward, and then bringing knowledge to those people that the way you are raising poultry, the way you are taking care of these animals is the way to go. It's a good way. It's a sustainable one. It's sustainable both from the public health perspective, as well from the animal health perspective, as well as economically speaking. So, as I said, increasing the awareness of people is general public is not an easy one, and this is one of the main things about this webinar. Media can play an important role, and then we have there are some links that are posted into this webinar where we have a lot of material in our webpage that you can use to educate people. We have also videos, etc., some material that you can also use to let people know that this is an important, that what you are doing, it's an important and the way to go, the way to do that in the future more sustainably.
Thank you. There are more.
Maybe, Shoba.
Yes, please.
Yeah,
yes.
Just a minute to add to what Javier said. So, and that is part of our big challenge at FL, for instance. So right now at FL, because when you give information to the farmers, it does not guarantee that they'll do something about it. They're about production. At FL, we've actually come up with a new initiative called Reduce the Need for Antimicrobials in agri-food systems. Using those materials Javier has talked about and other guidance we have from WAAW, from the Codex and IPC, we are designing approaches, and we use things like farmer field schools where we get farmers while they're doing their production, and farmer field school has been around for 30 years. We actually show them, you demonstrate to those poultry farmers that they actually can produce antibiotic-free chickens. That becomes very potent communication tools, because from their experience, then they can pass that knowledge over to other farmers. And when we engage media in that, local media in this case, to actually document these success activities, then we put into practice exactly what Javi is saying. We have guidance, we have these good stories, but when we teach by doing, when we use adult learning approaches, it seems much more potent. And I think Renofarm, the FAO initiative to reduce the need, promises that we are probably going to have much more success in food and agriculture than the routine and traditional way of communicating from the top to the bottom, is to do the actual practical things and from the ground level start communicating this issue upwards. And we're also developing tools to capture some of this data. So we are doing surveillance through the farmer field school approaches with the support of the Fleming Fund, so that we are not just going in, pick samples and use them, but where farmers are gathering and are actually learning these things, we pick samples and document the AMR and antimicrobial use as well. Yeah, thank you.
Thank you. There's a question from Kurmanath, Senior Deputy Editor of the Hindu Business Line from India. Any estimates on the financial burden of AMR, and which are the top victim countries with regards to antimicrobial resistance? Any of the panelists or speakers could answer that, any of the panelists.
I think Wondi has his hand raised.
Yes, Wondi.
I was not going to answer the question on the estimate, but I have already posted our report, and one of the things the report highlights is by 2030, I wouldn't give you which country, the list of countries, but an overall in terms of the global GDP could drop by $3.4 trillion by 2030. But I don't have a list of countries, but I didn't raise my hand to answer that question. I noticed we are coming to the end of the session. We have a few minutes. Just one or two things I wanted to flag is, one is, the COP28 on climate is just next month. It's a very good opportunity in terms of linking health and climate. In fact, there will be a health day on the 4th of December in Dubai, and I think that is another area you can mobilize your networks to participate or to engage in the health day. But also throughout, we have UNEP itself has a pavilion at the COP, so it's we will do something about the One Health approach. So that is one opportunity. And then the second one, maybe on the media side, is where do we get the champions? Because let's face it, the media we have today is they specialize in basically covering scandals and wars, all the nasty things that we want to see in life. It's being covered. But how do we really make them cover, life-saving issues like promoting the impact of AMR, and promoting the One Health approach? I think we should have more than just one citizens news service. We need to have more citizens news service who can actually cover issues like that, open the opportunity for people to debate at the country level. We heard great examples, whether it is raising organic chicken or in terms of the story of Vanessa. Question you should ask is, are these things really covered also at the country level in the same countries where these stories are coming out? So I think that kind of building the champions. Where are the champions to tell the good stories? This is about saving lives. This is saving our future. So I think we need to go beyond finding where are the champions to tell our stories. So that is something also we need to look into. Over to you.
Right. We have a question from Nanjinia Vamusava. Looking at the disheartening data, the millions of people we lose due to AMR, why are donors and funders not being attracted to this sad scenario, and why is there lack of funding? Philip, you had mentioned that. Any of the panelists could answer this, or all of you. It's not related to one particular one.
I can probably go first. Yes. I think the primary challenge is about breaking down this issue and conveying it clearly to the decision makers. I think as scientific community, we haven't been that successful in communicating and advocating about this issue to critical decision makers as such. So people don't understand the importance of this particular issue, the need to invest in this issue, and to have a follow-up on the commitments that they actually give during the major meetings. If you look at many of the global policy forums, the language is very good in the political commitments, I think, but then following up with bold and firm specific targets has been always a problem. So I think it's probably a failure of the scientific community in not communicating properly and not engaging the decision makers properly. That's one major point. Over.
Thank you. Anybody else would like to add?
Yeah, I'll just hit maybe just from the food and agriculture perspective, and you can see how resistance has developed. The economic case around antibiotics and antimicrobials hasn't been built well. We don't have a new class of antibiotics in 40 years because resistance does not drive the business case for antibiotics to start with. So what we need, and I think this is important for the ANGA 2024, is we need to frame this situation from an economic perspective. Lives will be lost. And I think Wanda was talking about GDPs, economies will be affected. That is what drives investment. If we can quantify this, and I think the quadripartite is working on an economic case, we are trying to also build an economic case from the farm level. And we need to communicate that this costs you. Vanessa said she had several series of surgery. it had a real economic impact on her life, something she will never recover, a 10-year loss. That we need to build as a case for AMR and show the decision makers that this is really costing you every day. AMR is going to cost your country, your economy, your industry so much. And we really need to do that. And then link that to what Philip was saying. Communicate it in very clear terms that policymakers understand. Thank you.
Thank you. There is one question from Chhatra Karki, who's a senior science and health journalist from Nepal. He's talking in the context of Nepal, but I think it would be applicable to other countries as well. That how does the growing threat of antimicrobial resistance going to potentially impact the effectiveness of vaccination programs? The existing vaccination programs, will it impact and how will it? Any of you are free to answer that. Anybody would like to answer that?
I can go first, and then probably my colleagues from FAO, WOAH, and UNEP can take over. Of course, there is a big interface between AMR and vaccines, because one of the primary reasons for increasing antimicrobial use in many parts of the world is basically a higher rate of infections. So when people have infections, they have to use antibiotics, and a higher load of infections also means a higher load of inappropriate use, especially when the health systems are weak. So definitely, when there are more infections, the antibiotic use will go up. When there are more infections, the proportion of inappropriate use also will go up, and that's our experience so far. And vaccination, vaccine preventable diseases, vaccination for vaccine preventable diseases will definitely impact the incidence of infections, the overall incidence of infections, and the need for antibiotics overall. So definitely, where possible, there has been a lot of debate about the efficacy of antibiotics in bringing, or rather vaccines in bringing down the overall antibiotic use. But then there are several studies now published which says that probably vaccines for pneumococcal infections can bring down antibiotic use in the long run. Vaccines for rotavirus infections can bring down the use of antibiotics. So there is evidence to show that vaccination will work in reducing the need for antibiotics and in actually reducing AMR in the long run. So there is an interface, but I'm not sure about how to explain whether AMR will affect vaccination. I don't think there is a causal relationship there, but there is a definite interface between these two issues. Over to my colleagues.
Anybody else would like to add something?
Yes, if I may jump in.
Yes,
Totally agree with what my colleague from WHO has said, and answering to the question, let's say in a provocative way, I hope that AMR is influencing positively on vaccination campaigns, and not from the scientific point of view, but from the behavior change point of view, because vaccination is prevention, and as my colleague from WHO has explained, it will reduce the need to use antimicrobials. And from the animal health perspective, we are advocating strongly for higher investment in vaccination, because to give you some order of magnitude, today from $10 invested in research and development, only 60 cents are dedicated to vaccines in animal health. And you can imagine that we have much more many species than the human sector, with poultry, swine, etc. So the amount of needs, it's incredible. And with this tiny amount of investment there, it's barely impossible for us to make any change. And then I'm going to add one comment to the previous question, which is why donors, why is not more funded dedicated to that? Well, the question should be asked to the politicians or to the ones deciding where the funds should go, even though I would not blame anyone for their hard task in terms of conflicting priorities, because with climate change, wars, electricity, energy, etc., it's never easy to have to make those decisions. But one of the things I think we are failing, and I think media can also help us, is in educating those people that solving this problem of AMR is not only is not only preserving these antimicrobials for generations to come, it's also helping to solve many other health issues that we have there. When you look at the top 10 mortality causes from WHO, basically 8 of them have AMR embedded into that, there. So if we improve the situation in the use of antimicrobials, we will improve the situation in the healthcare systems overall. And this is something I think we have failed in explaining that to the decision makers, and where media and our data can help in making the case. Over to you.
Thank you very much. Thank you. So now I think we have overshot the time, but this discussion can go on and on, and it is a very lively and interesting discussion. But let us move on to the third and last session of the day. I'm proud to announce the formal launch of the Global AMR Media Alliance, which already has, just a moment, please. Yes, or GAMA as we call it. And for the uninitiated, this alliance is a network of diverse media actors, including those in print, online, TV, radio, social media, content production, community media. And it's aimed to increase awareness and visibility of AMR in and through media, and demand stronger actions for ensuring responsible and appropriate use of antimicrobials in the context of global health security. And even as we launch it formally today, GAMA already has over 100 members worldwide from 20 countries and is going on strongly. And I would request the media persons who are here today, and if they have not joined this alliance, then please do so as soon as you can. Dr. Jeremiah Chakaya from Kenya and Professor Dr. Surikant from India co-chair the Scientific Advisory Committee of GAMA. So I request Dr. Surikant to say a few words. Dr. Surikant is head of Respiratory Medicine Department, King George's Medical University, and former national president of Indian Chest Society, National College of Chest Physicians, and Indian College of Allergy, Asthma, and Applied Immunology. Over to you, sir.
Okay. Thank you, Shobhaji. It's a wonderful opportunity for me also and for the whole world that you are debating on the issue of very important topic, that is antimicrobial resistance. Now, if you see the Indian perspective on this antimicrobial resistance, then this causes of antimicrobial resistance can be the four. One is the misuse of antimicrobes, overuse, inappropriate use, and the prolonged use. Now, mainly if you see the antimicrobial resistance, the 90% of the problem is with antibiotics. Now, if you see the Indian perspective, that the antibiotics are available over the counter throughout the country. There is no ban on any drug, any antibiotic. Number two, there is a pharmacist can directly dispense to anyone any antibiotic. There is no ban, no law, or no practice that you cannot sell directly to the public. The third, even the practitioners in this country, which are not belonging to the modern system of medicine, because antibiotic is a product of modern system of medicine. So even other system of practitioners, they are rather misusing antibiotics. And similarly, even those who are not qualified practitioners, means they are not qualified either in modern medicine or any system of medicine, in India, they are called quacks, and they are also misusing antibiotics. And that's why probably this menace is occurring. And as somebody has a question, I'll answer that it is predicted that by 2050, there will be 10 million deaths attributed to this antimicrobial resistance. Currently, it is 5 million, and by 2050, it is predicted to be 10 million, just double. And out of this 10 million, the majority of the problem is in South Asia. And if you see in terms of, somebody asked about the cost, financial burden. So by 2050, there will be loss of around 100 trillion US dollar. Yes, you heard correctly, 100 trillion US dollar financial burden by 2050 because of this antimicrobial resistance. So, and other than this misuse of antibiotics, there is an overuse, means unnecessarily the doctors and other medical fraternity people, they're using more than one antibiotic, 2 antibiotic, combination of 3 antibiotic. Antibiotic cocktail here is described as. And that is also leading antibiotic resistance and inappropriate use. And means diagnosis is not bacterial, but using antibiotic. Here, if you have sore throat, everybody say that yesterday I took azithromycin, amoxicillin. These are the commonly misused antibiotics for simple, trivial region viral infections, sore throat, and common cold. And prolonged use of antibiotics. You see, antibiotics are usually recommended for 7 to 10 days. So my recommendations are the 7. To cut short the story, I will say first, treat bacterial infection only. The antibiotics are meant for bacterial infection, not for viral, not for fungus, not for allergic, other infection. Optimize the diagnosis and severity assessment. So diagnosis, particular bacterial infection diagnosis is very maximize the bacterial eradication only. So you have to select the antibiotic, which is highly sensitive and it can eradicate the bacterial population. Recognize the local resistance pattern is a very important. Now, the Lucknow hospital will not have the different kind of hospital which the Uganda hospital will have or the other hospital will have. So the local, regional antibiotic susceptibility pattern and what are the bacterial, common bacterial infection we should know. And integrate the local resistance efficacy and cost effectiveness. You cannot prescribe the same antibiotic to a poor fellow and to a financially well-to-do fellow. And encourage the patient compliance. If you just prescribe and don't give the emphasis on the compliance of the treatment, that also leads to antibiotic resistance. So prescribe empirically, but intelligently. And I congratulate again on this launching of this forum. And here is a huge role of media. Only media can sensitize people and even the medical fraternity and even non-medical fraternity that please don't misuse the antibiotic, don't overuse the antibiotic, don't inappropriately use antibiotic because this is leading to the so much of mortality and so much of financial burden. Thank you, Shobhaji, for wonderful opportunity.
Thank you very much. I wonder if now I invite some of our GAMA leaders who are also its executive committee members to share their thoughts briefly. I hope Nurul Islam Hasib, special correspondent Dhaka Tribune from Bangladesh, is there. He had to rush off to for a meeting with the Prime Minister, but if he is there, perhaps he can speak. If not, I would request Kalpana Acharya, Editor-in-Chief of Health TV Online Nepal, to please share her thoughts.
Thank you, Shobhaji, for wonderful initiation. Actually, I am very much happy and delighted to be an executive member of Global AMR Media Alliance, GAMA. This is an important platform, of course, to understand AMR and let the people and media aware about this serious issue. I hope this alliance definitely will make some positive changes on AMR. Yes, we all know that antimicrobial resistance is a great challenge in our time, and it is a serious concerns too throughout the world. In this regard, awareness is very much important, and I think for awareness part, this alliance, GAMA, is the best platform. I believe it will be the best network to help strengthen and improve public health by supporting the development of high quality and authentic content, gathering and publishing information on AMR. Yes, GAMA is important for media as well as policymakers to report on AMR and tackle with it. Shobhaji, saying this, I would like to thank you all and
thank you.
Yeah, let's the hands together to aware the AMR issues. Thank you.
Thank you. I think we have Nurul Islam Hasib there. Perhaps he's traveling. Nurul, can you speak?
Yes. Sorry, but unfortunately you can see my face because I'm traveling. That's why. But thank you. Let's stop the video. So thank you, Shobha and Bobby, and all this initiative. It's a wonderful initiative. I think a lot of things can be done. But the thing is that from the media side, I think we need to make media aware of the situation because this antimicrobial resistance issue is not widely reported. I can tell from the Bangladesh perspective, we have like nearly 20 crore people, and here, the antibiotics or all the medicines we can buy from over the counter, but there is no like government data. There are surveillance system in the government from the health or from the livestock department, animal health department, but there is no data what is happening inside, and I think it's not being taken that much seriously because there are so many other pressing issues. So maybe policymakers are not that aware. General public, I would say, not at all, and even the media. From the media side, I think from this platform, I think we can do a lot of things. And but first of all, we need to make media understand the issue. What is this, and what kind of reporting we can do. So for that, I think for the training workshop, that would be useful initially, and then we can spread the knowledge to others also. Thank you again. Sorry that I have to attend the government briefing, and that's why I left the office.
No, thank you very much. Thank you, Nurul, for finding time. We have Caroline Oyugi from Kenya Environment and Science Journalists Association from Kenya. Caroline, over to you.
Hello, everyone. It's really nice being with you here today. Let me start maybe. It's really nice being here today, and AMR issues are coming up at a time when the media is really struggling to stay afloat. So a lot has been said, and fortunately, there are associations like KESJA who have deliberately decided that they're going to report on issues related to health, environment, and science, and this is where AMR lands. So we are very happy to be members of GAMA. I've had a lot of accusations where, specifically from Javier, where he said that the media is very interested in scandals and such stories. But that might be true, but things are slowly changing. The journalists who are now specializing, and they can confidently introduce themselves as health reporters or science reporters and all that. But with all this, there are challenges. One challenge is the lack of capacity building is needed. Health issues keep revolving every now and then, and that is why even for the scientists and the researchers, they have to read every day for them to be up to date. So you can imagine how it is for journalists who are also reporting on other issues, and they have to report these issues accurately and in a way that can be understood by everyone. So journalists really need to be to learn before they pass this message to the audience. So we really need capacity building. So even as we pass the message, we also understand what we are talking about. Then these issues have also come at a time when the media is really struggling financially. I don't know how it is in other parts of the country, but in Kenya, some media houses are closing, some have issues with paying their reporters and all that. So as a result, media houses have this tendency of concentrating on stories that are sexy and being sexy in a manner that it attracts advertisement. So as a way forward, I think funders and people who are working with organizations where they can chip in financially and support journalists, this would be really great, because journalists are already interested in this topic. Once they have the knowledge and they have the time, there's nothing that will stop us from reporting on this issue. And during my training as a journalist, I was told by my professor that a message has been passed when my grandmother in the village can understand it in her own language. So all these are very complex, but with the partnership that is coming up, with the scientists educating us on what is happening, and with the financial support, if you have the workshops and the trainings and all that, all will be good. That's all I have to say.
Thank you, Caroline. Thank you for giving the story from the side of the journalist and media also. Thank you very much. I now request Padma Shri Patricia Mokim, who's editor of the Shillong Times India, to please say something. Patricia.
Yeah, thank you, Shobha. I don't know if you can hear me.
Yes, we can hear you very clearly.
No, somebody had said earlier that actually children would be the best communicators. Children, not necessarily just the youth, but these days we find that we need to communicate a lot to smaller kids who then take the message to their parents, especially in the rural areas where I think the misuse of of antibiotics is very high. People buy medicines off the counter. Everyone keeps loads of medicines at home, and I'm wondering how people are medicating themselves. But this is a very little known aspect of medicine. So, and in the media, I think we are equally unaware of the impact of such misuse of antibiotics. So I think someone had earlier stated that we too need to be trained on how to report this without creating a fear psychosis, but to create enough awareness among the public. But I'm thinking of school students, of the teachers who are teaching health education. I've been a teacher myself for a long time, and we don't have anything related to this aspect in the curriculum. I think the health education books need to be revised. They need to be more clued into the present crises across the country in the health scenario, so that these things get discussed in the classroom. I think it's a very powerful medium, to be discussing this in the classroom in a non-threatening atmosphere where children can ask questions and the teacher can answer, but the teacher has to also have enough information with her to be able to communicate in a way that doesn't create panic. As far as the media is concerned, we, I think, still need a lot of awareness programs ourselves before we communicate, because there's a tendency of communicating in the wrong kind of spirit and creating panic and creating unnecessary, arguments. You write down a report today and the next day there'll be 101 questions. So we need to be ready with those questions, with those answers as well. So we need, I think, a sort of a handbook on how to deal with this, how to report this. If people from the WHO can give us this handbook. I don't think it is fair to say that the media knows everything and the media are experts. We have to deal with so many things on a given day, because most of us do not have one reporter just for reporting on health issues. Our reporters are reporting on everything under the sun. So we need some kind of a handbook for this. Thank you, Shobha.
Thank you very much. Thank you, Patricia. We have a written message from Rita Vidyadana, former editor of Jakarta Post, Indonesia. She has been here throughout this session, but she underwent an operation and has been told by her doctor not to speak. So she sent this message, and we'll put it in the chat box also, and I will read what she has sent. It was great to hear the presentations of distinguished panelists to equip us journalists with important knowledge and information on AMR. In my experience as a health journalist of a very long standing in Indonesia, this issue has not been prioritized within the local media. In December 2022, with support from Indonesian Ministry of Health, WHO Indonesia Office, CNS, APCAT, and academia in Indonesia, I had helped organize a media workshop in Bali on One Health approach in reporting on health and development issues. The workshop was attended by more than 50 journalists and editors. Majority of the participants said that the quality and quantity of health reporting had increased in Indonesian media, especially during COVID-19 pandemic. However, they acknowledged a lack of understanding and knowledge on AMR and One Health approach. They also found it difficult to speak with experts, public health officials, and other related people, especially at sub-national levels. All participants requested to have regular capacity building trainings on AMR. We Indonesian journalists hope that this global AMR Media Alliance will become a strong platform for journalists around the world to build vast networking with experts, academia for better understanding of AMR and to boost the knowledge and skills for the production and dissemination of information related to AMR to the public. So that was from Rita. We have Zivonia Vieira, editor, Neon Metin Media, and president of Timor-Leste Journalists Association. I do not know if she is there or not. I don't think she is there. Yes, she is there. Yes, Zivonia. She is, I can see her, but she doesn't have the audio. She doesn't have the audio, maybe some connectivity problem because she's from Timor-Leste. All of us can face these internet problems. Okay, so we'll have more to hear from her later on. And with this, we come to the close of this third annual Global Media Forum. My sincere thanks to all the speakers for their valuable inputs in making this forum a success. Special thanks to the quadripartite organizations FAO, UNEP, WHO, and WOAH for extending their unstinted support. And last but not the least, an applause for all our participants for enriching the sessions with their active participation through questions and comments. I'm sure all of us will join hands and use our learnings of today to contribute towards preventing antimicrobial resistance together. Keeping in mind, it is not just antibiotic resistance, but also resistance to parasites and to viruses. And preventing antimicrobial resistance together is also the theme of World AMR Awareness Week. And so with this resolve, I say goodbye. Bye till we meet again. Stay safe and stay healthy. And fight together on a war footing. Thank you very much.
Thanks and goodbye, everyone.
Thank you.
Bye.
Thanks, everyone.
Thank you, everyone.
Thank you.
Bye-bye.
Thank you very much. Have a good day.
Thank you. Thanks to all of you for being
Shobha ji
there.
for wonderful moderation.
Thank you. Thank you.
And for the very crisp comments from all the panelists.
Yes, yes. Panelists and participants alike. It was, it could have gone on and on. If we had the time, we would have continued. But we will again meet. Thank you.
Sure.
Thank you so much. Bye-bye.
Bye.